I want to talk to you today about something that creeps up on a great many older adults so gradually that they adjust to it without quite noticing, and then write it off entirely as just getting older. Feeling out of breath doing simple, ordinary things. Climbing a flight of stairs you used to manage easily and having to stop at the top to catch your breath. Getting winded carrying the shopping or walking to the corner, or even making the bed, or getting dressed. And the natural assumption is, well, I'm getting older. I'm just out of shape. This is what happens. And here's the honest, important truth I want to share with you today. While some decline in stamina is a normal part of aging, becoming genuinely breathless doing simple everyday activities is not something to simply accept as inevitable, because it can be a sign of an underlying condition, often a very treatable one, that's quietly limiting you. Breathlessness is one of those symptoms that people adapt to and dismiss, when it's actually their body asking for attention. So today I want to explain what breathlessness really is, the common and important causes behind it in older adults, why it's so often missed, and what to do, all calmly and clearly. Because feeling short of breath doing simple things deserves to be understood, not just endured. Let me start by being clear about the difference between normal and not normal, because that distinction is the heart of this. It's true that as we age, our heart, lungs, and muscles become somewhat less efficient, and our peak capacity for hard exertion declines. So it's normal to be more winded than you were at 30 when you really push yourself, running for a bus, climbing several flights quickly, doing something strenuous. That kind of reduced reserve for vigorous effort is ordinary aging. But here's the key. Becoming breathless during simple, light, everyday activities, the kind you used to do without a second thought, walking on the flat, light housework, getting dressed, climbing a single flight of stairs, is not normal aging, and it's not something to dismiss. When ordinary, gentle activities leave you genuinely short of breath, that's a meaningful change worth understanding, because it usually means something is making it harder for your body to get oxygen where it needs to go. So the dividing line I want you to hold is this. More winded than you used to be, only with real exertion, may be ordinary. But breathless doing simple, light, everyday things is a signal worth heeding, not a verdict of age to be accepted. Let me explain what breathlessness actually is, because understanding it points to the causes. Breathlessness, what doctors call dyspnea, is the uncomfortable sensation of not being able to get enough air, of having to work to breathe. Your body's job is to take oxygen from the air into your lungs, transfer it into your blood, and pump that oxygenated blood to all your tissues, while removing the waste carbon dioxide. Breathlessness arises when something interferes with that system, when your lungs can't take in or transfer oxygen properly, when your heart can't pump the oxygenated blood effectively, when your blood can't carry enough oxygen, or when your body's demand outstrips supply. So breathlessness is, in essence, a signal that the oxygen delivery system is under strain somewhere. And because several different organs and systems are involved, lungs, heart, blood, breathlessness can come from several different causes, which is exactly why it's worth getting to the bottom of, rather than guessing. Let me walk you through the main causes in older adults, because understanding them shows why this matters. The first major category is heart conditions, and this is one of the most important, because breathlessness is often the heart's way of signaling trouble. One of the most significant is heart failure, which, despite its frightening name, doesn't mean the heart has stopped. It means the heart isn't pumping as efficiently as it should, so blood and fluid can back up, including into the lungs, causing breathlessness. Heart failure causes shortness of breath on exertion, and sometimes when lying flat, along with fatigue and swelling in the legs and ankles, and it's common in older adults and very treatable, especially when caught earlier. Other heart problems can cause breathlessness too. Coronary artery disease, where narrowed heart arteries limit the heart's blood supply, can cause breathlessness as well as chest discomfort on exertion. Heart valve problems, which become more common with age, can cause it, and irregular heart rhythms like atrial fibrillation can cause breathlessness along with palpitations and fatigue. So a significant share of breathlessness in older adults comes from the heart, and because heart conditions are both serious and treatable, this is a major reason to take breathlessness seriously and get it evaluated. The second major category is lung conditions. Chronic obstructive pulmonary disease, often called COPD, which is largely related to smoking and is common in older adults who smoked, causes breathlessness, often with cough and reduced exercise tolerance, and while it's not curable, it's very treatable in ways that improve breathing and quality of life. Asthma can occur or persist in older adults. Lung infections like pneumonia cause breathlessness, usually with feeling unwell, fever, and cough, and need prompt treatment. Other lung conditions, including scarring of the lungs and, importantly, lung cancer, can cause breathlessness, which is part of why new or worsening breathlessness, especially in a smoker or former smoker, warrants evaluation. And a blood clot in the lung is a serious cause of sudden breathlessness that's a medical emergency. So the lungs are the other major source of breathlessness, with conditions ranging from common and treatable to serious, all worth identifying. Let me give you the other important causes, because they're common and some are very treatable. Anemia, which I've discussed elsewhere, is a major and often overlooked cause of breathlessness. When your blood is short of red cells or hemoglobin, it can't carry enough oxygen, so your body becomes breathless trying to compensate. And anemia is common in older adults and very treatable once found, often with a simple blood test revealing it. Being significantly overweight or deconditioned, simply being very out of shape from inactivity, genuinely causes breathlessness. And here's the hopeful part. Deconditioning is reversible with gradually increasing activity, and in fact, a vicious cycle often develops where breathlessness leads to less activity, which leads to worse fitness, which leads to more breathlessness. A cycle that can be broken by carefully, gradually rebuilding activity, ideally with medical guidance. Anxiety and panic can cause breathlessness and a sense of not getting enough air. Thyroid problems can contribute, and conditions affecting the muscles involved in breathing or causing general weakness can play a role. So, breathlessness in older adults has a range of causes: heart, lungs, blood, fitness, and others. And the treatment depends entirely on which one is at work, which is exactly why a proper evaluation matters rather than just assuming its age. Now let me explain why breathlessness is so often missed, because this is crucial, and it's the reason I wanted to talk about it. Breathlessness from these conditions usually comes on gradually, over months or longer, and human beings are remarkably good at adapting. As you slowly become more breathless, you unconsciously do less. You take the stairs more slowly, or avoid them. You walk less far. You give up activities that wind you. You rest more. By scaling back your activity to stay within your shrinking comfort zone, you avoid triggering the breathlessness, and so you may not even notice how limited you've become. And you attribute the whole thing to just getting older and slowing down. This adaptation is exactly why serious, treatable conditions like heart failure, COPD, and anemia so often go unrecognized in older adults for far too long. The person has quietly accommodated the breathlessness, rather than recognizing it as a symptom to report. So I want to gently challenge that adaptation. If you find you've been doing less, avoiding stairs or exertion because it makes you breathless, please don't just accept that as age. Recognize it as your body signaling something worth checking, because the underlying cause may be very treatable, and treating it could give you back activity and quality of life you've gradually surrendered. So let me be clear about when and why to see your doctor, because that's the actionable heart of this. You should see your doctor if you've become breathless doing simple, everyday activities that you used to manage easily. If your breathlessness is new, persistent, or getting worse over time. If it comes with other symptoms like swelling in your legs and ankles, chest discomfort or pain, a cough, palpitations or an irregular heartbeat, fatigue, or feeling faint. Or if it's interfering with your daily life. And certain situations are urgent. Sudden, severe breathlessness, breathlessness with chest pain, breathlessness with blue-tinged lips, or being so breathless you can barely speak or function, are reasons to seek emergency medical help immediately, because they can signal a heart attack, a blood clot in the lung, or another serious acute problem. But for the common, gradual breathlessness on simple activities, the message is to make an appointment with your doctor, calmly, but without indefinite delay. Because identifying and treating the cause, whether it's a heart condition, a lung condition, anemia, or deconditioning, can genuinely improve both your breathing and your life. Breathlessness is a symptom that deserves an explanation, not a shrug. Let me tell you what to expect at that evaluation, because knowing makes people more willing to go. The doctor will ask about your breathlessness, when it happens, how it's changed, what brings it on, and about other symptoms and your history, including smoking. They'll examine you, listening to your heart and lungs, and checking for things like leg swelling. And they'll often do some straightforward tests to find the cause. A simple blood test can check for anemia and other things. Tests of your heart, like an electrical tracing or an ultrasound of the heart, can assess heart function. Breathing tests can assess your lungs, and a chest image can look at your heart and lungs. These are mostly simple, painless, widely available tests, and together they usually identify what's behind the breathlessness, pointing the way to treatment. So the path to an answer is straightforward, and the payoff, finding a treatable cause and getting back some breath and some life, is well worth it. Let me paint you a picture of how this commonly plays out, because it captures the quiet adaptation and the relief of finally addressing it. Picture a woman in her 70s who, over the past year or so, has gradually become breathless climbing the stairs in her home, carrying her shopping, even doing a bit of housework. Without quite deciding to, she's adapted. She goes up the stairs slowly and rests at the top. She makes fewer trips. She's given up some activities she used to enjoy, and she's chalked it all up to age and being out of shape. She doesn't mention it to anyone because it feels like just getting old. But her breathlessness is actually a sign of early heart failure, quietly limiting her, and she also has some leg swelling she'd attributed to standing. Eventually, perhaps because a relative notices how breathless and limited she's become, she sees her doctor, who examines her, does some tests, and diagnoses the heart failure. With the right treatment, her breathing improves markedly, the swelling goes down, her energy returns, and she gets back activities she'd gradually surrendered, astonished at how much she'd been accommodating without realizing it. The breathlessness she'd dismissed as age was a treatable condition all along. Now, in a different version, the cause might be anemia found on a blood test, or COPD that responds to treatment, or deconditioning that improves with a gradual, guided exercise program. In every version, the lesson is the same. Breathlessness on simple activities is a signal worth heeding, not an inevitability to accept. And identifying the cause can give you back your breath and your life. And let me speak directly to those of you caring for or close to an older person, because breathlessness and the adaptation to it are often easier to see from the outside. You might notice that a loved one has slowed down, avoids stairs or exertion, gets winded easily, has stopped doing activities they used to do, rests more, or has swelling in their legs or persistent cough. Because they may have quietly adapted and attributed it all to age, they might not recognize or report it as a problem. You can help by noticing the change and gently encouraging a doctor's visit, framing it not as alarm, but as worth getting checked, because breathlessness on simple activities often has a treatable cause, and treating it can restore activity and quality of life. You can be especially attentive if the breathlessness comes with leg swelling, chest discomfort, a cough, palpitations, or fatigue, which point toward heart or lung causes worth evaluating. And you should know the emergency signs: sudden, severe breathlessness, breathlessness with chest pain or blue lips, which need immediate help. Helping a loved one recognize that their gradually shrinking, breathless world isn't just age, but a signal worth investigating, can lead to treatment that genuinely opens their life back up. Let me draw this all together. Feeling out of breath doing simple, everyday activities is not something to dismiss as inevitable aging. While some loss of reserve for hard exertion is normal, becoming genuinely breathless during light, ordinary activities you used to manage easily is a meaningful signal that your body's oxygen delivery system is under strain somewhere. The causes in older adults include heart conditions like heart failure, coronary artery disease, valve problems, and irregular rhythms. Lung conditions like COPD, asthma, infections, and others. Anemia, a common and very treatable cause. Being significantly deconditioned, which is reversible. And anxiety, thyroid problems, and more. Crucially, breathlessness is so often missed because people adapt to it gradually, quietly doing less and less to avoid it, and attributing the whole thing to age, which is exactly how treatable conditions go unrecognized for too long. So, breathlessness on simple activities deserves a calm but real visit to your doctor, who can examine you and run simple tests to find the cause. With certain acute situations, sudden, severe breathlessness, breathlessness with chest pain or blue lips being medical emergencies. So here's what I'll leave you with. First, understand the dividing line. Being more winded only with hard exertion may be ordinary aging. But becoming breathless doing simple, light, everyday things you used to manage easily is a signal worth heeding, not an inevitability to accept. Second, notice whether you've been quietly adapting, avoiding stairs, doing less, giving up activities, to stay within a shrinking comfort zone, because that adaptation is exactly how treatable breathlessness gets dismissed as age. Third, see your doctor about new, persistent, or worsening breathlessness on simple activities, especially if it comes with leg swelling, chest discomfort, cough, palpitations, or fatigue. Because the cause, whether a heart condition, a lung condition, anemia, or deconditioning, is often very treatable, and treating it can give you back breath and life. Fourth, know the emergency signs: sudden, severe breathlessness, breathlessness with chest pain or blue lips, or being unable to speak for breath, and seek immediate help for those. Breathlessness on simple things is your body asking for attention, and far more often than people realize, that attention leads to a treatable cause and a real improvement. So take care of yourself. Don't simply surrender your activities to creeping breathlessness, and get it checked. And because only a doctor can examine you and run the tests to find the cause, please treat breathlessness on simple activities as your reason to see your own physician, who can identify what's behind it and help, rather than as a substitute for that visit, and seek emergency care for any sudden or severe breathlessness.